COVID-19 pandemic saw a global scramble for vaccines. While some countries were prioritized, many developing nations were left behind. And when they didn't get their vaccines, they were made to pay a whole lot more. After a lengthy court battle led by the Health Justice Initiative, it seems the South African government was overcharged as well. Newzroom Afrika's Nick Anderson has more.
This month, the Health Justice Initiative released its review of several procurement agreements after a court ordered the government to disclose the documents. The findings don't make for good reading, especially when South Africans are still paying from previously exposed COVID-19 corruption. While there's no evidence of corruption in securing vaccines, the Health Justice Initiative says the South African government was pushed by the vaccine manufacturers into secrecy.
Contrary to what government may want to now suggest that they weren't bullied, we actually believe that if you look at these terms and conditions, that our government and others in the Global South were indeed bullied, and they were bullied into very one-sided agreements in order to get access to very limited supplies at a time when they needed more supply certainty.
So just how much more was SA made to overpay compared to other developing countries? According to the HJI, the contracts they have seen show that Pfizer charged SA over 32% more than the reported AU cost price. Johnson & Johnson charged SA 15% more than it charged the European Union. This really hits home when you see that Pfizer and J&J both allegedly charged South Africa $10 per vaccine dose, with tens of millions needing to be bought.
We were told that we were all in this together, there would be solidarity, there wouldn't be unfair pricing. But what we found, based on the analysis of just the 4 contracts that have been given to us, Johnson & Johnson, Pfizer, COVAX and Serum Institute of India, is that what was authorized to be charged in these contracts and agreements is different to what was, for example, charged to in other countries. And in some cases, we were charged substantially more.
Hassan also says that these contracts included terms that stated that even if the vaccine manufacturers were unable to deliver their supply, South Africa would still be liable for a part of the payment. And despite these revelations, more shocks might be on the way. At the end of September, the HJI is set to receive all negotiation minutes between the government and the various vaccine manufacturers. For Newzroom Afrika on Channel 405, I'm Nick Anderson in Johannesburg.